Hello friends, today we will be discussing about the most important topic in cardiovascular system, that is hypertension. Now to understand the hypertension, first of all we need to understand some basic fundamental concept of blood pressure. As per JNC 8 guideline, hypertension is defined as persistent elevation in arterial blood pressure more than 140/90 mmHg. This is the revised blood pressure value. Earlier, as per JNC 7 guideline, it was 120/80 mmHg. Now, after amendment in the JNC 8 guideline, it has changed from 120/90 to 140/90. Now, in order to understand the hypertension, first of all, we need to understand the importance of these two values. Now, these two values is reflecting. One value reflects systolic blood pressure and the second value reflects diastolic blood pressure. So let us understand what is systolic and what is diastolic blood pressure using this schematic diagram. So this is nothing but the left ventricle, this is left atria, and this is left ventricle. So to understand systolic blood pressure, first of all we will understand the anatomy of left ventricle or ventricular system. Left atria and left ventricle are separated by mitral valve, and left ventricle and the major systemic arteries are separated by aortic valve. Now, when the left ventricle contracts, when the left ventricle is filled with the blood, and then when left ventricle contracts, blood will go from this area to major systemic artery, because during that process this mitral valve is closed. So when the left ventricle contracts, blood will come to this major systemic arteries. There will be certain kind of pressure generated in this major systemic arteries. And we all know that we measure the blood pressure in brachial artery. So while the contraction occurs, the blood comes to the major systemic arteries, and during this process if you measure the blood pressure, the value of the blood pressure is near to 120 to 140. That is systolic blood pressure. In this condition, blood cannot go back because of this aortic valve. It can only go forward to the systemic circulation. Considering this scenario, if I want to define precisely systolic blood pressure, it will be when the left ventricle or ventricular system contracts, blood go from ventricle to the major systemic arteries. Due to valvular system in our body, it cannot go back, and because of that reason arterial system has more pressure, and that pressure will be near around 120 to 140 mmHg. Second is a diastolic blood pressure. Now diastolic blood pressure is the pressure in the major systemic artery when the left ventricle is filling, when the diastole is going on. So after contraction, when left ventricle has a filling time, that is called diastolic time. During this time, there will be no pressure from left ventricle to the major systemic artery. Only pressure will be because of this narrow arterioles. Blood can go only to the forward direction, as we discussed earlier. Because of this aortic valve, it cannot go back. It can only move forward. But because of this narrow arterioles, it cannot travel very fast. So there will be certain pressure again remain even in the relaxing condition of the heart. And that pressure, when we measure, it will be around 80 to 90. That is called diastolic blood pressure. So once again, if I want to precisely define diastolic blood pressure, when the left ventricle or ventricular system is relaxing, during that time, whatever pressure felt in the major systemic arteries is known as diastolic blood pressure. So this is about systolic blood pressure and diastolic blood pressure, and why systolic blood pressure value is higher compared to diastolic blood pressure. If you can see, 140 is higher compared to 90 because the pressure will be higher during contraction, and during relaxation or filling time, when the heart is filling, that time the pressure will be lower. This pressure is measured in the arterial system, and that is why we have a difference in systolic and diastolic blood pressure. Now when we understand this systolic and diastolic blood pressure, we need to understand that these values, these different values are a predictive marker of cardiovascular consequences. So if I want to say person having age less than 60, which is anything around 30 to 59 years, during this age diastolic blood pressure. This diastolic blood pressure is the predictive marker of cardiovascular disease. When we say that young patients are having more blood pressure, we majorly focus on diastolic blood pressure compared to systolic blood pressure, because this diastolic blood pressure is the predictive marker of cardiovascular consequences or cerebrovascular consequences. When we talk about patient having age that is more than 60 years, in elder patient, diastolic blood pressure will play a role, but along with diastolic blood pressure, systolic blood pressure will be a predictive marker of cardiovascular as well as cerebrovascular complications. Now, some of the clinicians are using concept called pulse pressure as a predictive marker of cardiovascular disease. Now, what is pulse pressure? To understand the pulse pressure is calculated based on the systolic and diastolic blood pressure value. So when we use this equation, systolic blood pressure minus diastolic blood pressure, we will get the pulse pressure. And this pulse pressure is somewhere around 40 to 60 mmHg. So anything more than this or less than this will be a negative predictive marker of cardio as well as cerebrovascular disease. So I'll give just a simple example of this value. 140 by 90 will come around 50 mmHg, and that 50 is in between 40 to 60. So it is considered as a normal pulse pressure. If the pulse pressure goes more than 60, it is known as wide pulse pressure. It is known as wide pulse pressure. If the pulse pressure goes less than 40 mmHg, it is called as a narrow pulse pressure. Both the conditions are not good for future consequences in terms of cardio as well as cerebrovascular disease. After understanding the concept of systolic blood pressure, diastolic blood pressure and pulse pressure, let us understand the concept of mean arterial pressure and mean systemic pressure. So to understand the mean arterial pressure and mean systemic pressure, we need to understand the basic blood flow inside the heart. So just look at this diagram. This is the left atria, left ventricle. This is major systemic arteries, arterioles, venules, major systemic vein, right atria, right ventricle and the lungs. So blood will go from left ventricle to the major systemic artery, and these systemic arteries are carrying this blood to arterioles. These arterioles will deliver the oxygenated blood to the vital organs like kidney and other vital organs like brain, lungs. After that, this oxygenated blood will become deoxygenated, which will come to the venous system. This venous system will carry the blood which is deoxygenated to the major systemic vein, through major systemic vein to right atria and right ventricle. From right ventricle it goes to lungs for the purification, where gaseous exchange will occur, and from this particular place deoxygenated blood will convert into oxygenated blood, will go to the left atria and then left ventricle, and then again it start circulating inside the body. Now we need to understand first that arterial system is considered as a high pressure system because left ventricle contracts with the oxygenated blood, whereas venous system is considered as a low pressure system compared to the arterial system, as it carries deoxygenated blood and again it is carrying it back to the heart, not to the systemic circulation. When left ventricle contract, it has to push the blood to the whole body, so the system has a high pressure. But here the blood has to be collected from the body and it has go back to only heart, and that is why this venous system is having low pressure. It is called a low pressure system. Now to understand the mean arterial pressure, we need to understand the cardiac cycle. Now cardiac cycle, if we divide as per systole and diastole, cardiac cycle is 1/3 of systolic blood pressure and 2/3 of diastolic blood pressure. Now to understand, let us focus in this figure. If I say 0 second, 3 second, 9 second. So as I said, cardiac cycle is composed of 1/3 of systolic blood pressure. 0 to 3 second, the body is having 120 mmHg blood pressure, and 3 to 9 second, body will have 80 mmHg blood pressure. mean arterial pressure is mean of systolic as well as diastolic blood pressure, where we need to consider the duration of systole as well as duration of diastole. So this particular juncture, if I want to calculate, body will maintain 80 mmHg blood pressure throughout the cardiac cycle, but for 1/3 of part, body is maintaining additional 40 mmHg blood pressure. So when I divide this 40 by 3 to calculate the mean arterial pressure, it will be around 13. Now 80 plus 13 will be 93 mmHg. This is considered as mean arterial pressure, which will be considering systole and diastolic duration of a cardiac cycle. Anything between 90 to 100 is considered as normal mean arterial pressure. Second concept is mean systemic pressure. Now this mean systemic pressure is not only arterial pressure. This is mean arterial pressure is word itself says that it is arterial pressure, but this mean systemic pressure is an average of arterial pressure plus capillary pressure plus venous pressure. So it is an average of arterial pressure, which is a high pressure system, capillary and venous pressure, which is low pressure system. I am not talking about the addition of artery pressure, capillary pressure and venous pressure. I am talking about the average mean of artery, capillary and venous pressure. So because of this reason, this value comes around 90 to 100, but this value comes around 6.5 mmHg. This drastic reduction in from mean arterial pressure to mean systemic pressure is because capillary and venous system is low pressure system. This is why I have explained that this is high pressure system and this is low pressure system, and why we consider this is high and this is low pressure system. Secondly, if I want to precisely define mean systemic pressure, when the heart stops, when the heart is not beating, when the heart stops, during that time, whatever pressure maintained in the systemic circulation is called mean systemic pressure. So this is how the concept of mean arterial pressure and mean systemic pressure will be very important while clinicians are making diagnosis. Now let us understand the concept of preload and afterload. This is the two fundamental concepts in heart we need to understand so that we can understand precisely about the cardiovascular system. Now preload is also known as end diastolic volume. Now to understand preload, if we take an example of a left ventricle or ventricular system, when this left ventricle is filling, the blood is coming from left atria to left ventricle. Now here I want to quote the Frank-Starling's law. Now Frank-Starling's law says that when the ventricular system is filled with more blood, it will contract with more force. So filling is directly proportional to the force of contraction. If filling is more, contraction is more. If filling is less, contraction is less. So this concept we need to understand before we go to the concept of preload. Now preload, as I said, it is known as end diastolic volume. Means it is the volume of blood present in the heart just before contraction. If I want to precisely explain, after completion of filling time, whatever blood is present in the left ventricle, and then now contraction is about to start, systole is about to start. Before systole, whatever blood present in the left ventricle is defined as a preload, right? So preload is volume of blood present in the left ventricle here just before systole or just before contraction. That is a concept of preload. Why I am explaining preload? Because if by any mean the filling time has increased, then also there will be high chance that preload will increase. And if the volume is itself increased, then also there is a high chances that volume inside the left ventricle just before contraction will increase. So if preload is increasing, the amount of blood coming out of the left ventricle or ventricular system is high, which will directly impact the blood pressure, because we understood that systolic blood pressure is depending on the amount of blood volume coming out of the ventricular system. So this is a concept of preload. Second is afterload. Now afterload is very important to understand because it is also known as total peripheral resistance, right? So Now when the blood is in this particular arterial system, as I said, there will be closure of aortic valve. So blood, after contraction of ventricle, blood cannot go back from artery to heart. So it will only have one direction, that is move forward. To move forward, blood should have some very open passage. But if you see in this figure, this is arterioles, this is venules, right? So blood is going to in forward direction where there is a certain arterioles having a narrow diameter. So it cannot directly go forward, it will slowly go forward. So while going forward, these smaller arterioles or venules create certain kind of resistance against the blood flow coming from the major systemic artery, and that is known as afterload. Resistance offered by the arterial system against blood to the major systemic arteries is known as afterload. Again, precisely if I want to define afterload or total peripheral resistance, it is a resistance offered by the arterioles to the blood coming from major systemic artery, right? It is called afterload. This afterload increases when vein system or venules are constricted or arterioles are constricted. Otherwise, in normal condition, there is a normal pressure resistance offered by these arterioles, but when the arterioles are constricted, venules are constricted, there will be some resistance offered, and that will increase the afterload or total peripheral resistance and ultimately diastolic blood pressure. Now let us understand the basic concept of blood pressure. So blood pressure is basically dependent on cardiac output and total peripheral resistance. Now here I want to mention a very important thing, that blood pressure equation, I hope everyone is aware about the equation of blood pressure. Blood pressure is equal to cardiac output into total peripheral resistance. Majorly, this cardiac output is reflecting the systolic blood pressure value, whereas this total peripheral resistance is reflecting the diastolic blood pressure value. This you can understand from the concept of systolic blood pressure and diastolic blood pressure we had discussed earlier. Because if the left ventricle contracts and blood comes out from the left ventricle to the artery, that is nothing but cardiac output. So cardiac output is defining the systolic blood pressure. Whereas from the artery system, blood is going forward to the arterioles where the resistance is offered. This resistance against this blood flow is called as total peripheral resistance. If it is high, it will affect the pressure in the artery when the heart is relaxing. That is why total peripheral resistance is reflecting diastolic blood pressure. Now to understand how our blood pressure is affected in the body, we need to understand this concept. So total peripheral resistance is dependent on many parameters, which will be covered under the afterload, which is one of the parameters affected in cardiac output. So I must say that cardiac output and total peripheral resistance are interdependent variables and not independent variables. Please understand, these two are interdependent. If this is affected, ultimately this will be affected. This can be understood by, if blood pressure value is depend on cardiac output and TPR, total peripheral resistance, if we 2 times increase cardiac output, then there is no twice increment in the TPR, right? Because cardiac output if increased 2 times, there will be ultimately some rise in total peripheral resistance. So we cannot say that these two parameters are independent, they are interdependent. This is what I want to explain. Now to understand cardiac output in detail, cardiac output is again divided into 2 main factors. It depends on stroke volume and heart rate. Now heart rate is very important parameter over here. Why? Because heart rate, when we consider, we have a normal heart rate from somewhere around 60 to 100 beats per minute, and we take some mean like 72 beats per minute. If I want to disseminate this concept, if we convert this 72 beats per minute using the seconds in 1 minute, that will be 60 seconds divided by 72 beats per minute. It will be around 0.8 second for 1 beat. We required 0.8 second for 1 beat. So in this 0.8 second, 0.3 second is for systole and 0.5 second is for diastole. 0.3 second for systole and 0.5 second for diastole. So why I am explaining this? Because when the heart rate increases, this duration decreases. If this duration decreases, systole and diastole duration will also decrease. Now, if you have understand the concept precisely, if diastole decreases, then the filling time decreases. If the filling time decreases, cardiac output decreases. So, when the heart rate increases initially, there will be rise in blood pressure. But later on, there will be no rise in blood pressure because decrease in diastole decreases preload, decreases blood pressure. This is what I want to explain in heart rate. Coming to the stroke volume. Stroke volume depends on preload, afterload, contractility. We understood the preload. Preload is end diastolic volume. Volume present inside the ventricle just before contraction. Afterload is resistance offered by the arterioles against the blood flow coming from the major systemic artery. Contractility. Now this contractility is an ability of a cardiac wall to push the wall and to contract. So this contractility is different from the heart rate. We all know that heart is composed of 3 layers. It is, and left ventricle is having very thick wall. So the wall is creating a pressure to the left ventricle to contract. So contractility is basically force of contraction we are talking about, and heart rate is again a different concept, and that is why contractility is reflected in the form of inotropic effect and heart rate is reflected in the form of chronotropic effect. Now contractility is affected when a patient is taking negative inotropic agent. So if someone is taking negative inotropic agent, it decreases force of contraction, it decreases contractility, it decreases stroke volume, and ultimately decreases cardiac output, it decreases blood pressure. Second, if person is having myocardial infarction or person had myocardial infarction in the past because of the death of certain tissue in the heart will not have that much capacity to forcefully contract, and thus again contractility reduce, stroke volume will reduce, cardiac output will reduce, it will reduce the blood pressure. Similar condition like acidosis and serum electrolyte imbalances will also affect the contractility of the heart. Now come to the preload concept, where preload is basically depending on the venous system. Why I am talking about venous system? Because vein system is collecting the blood from the body and taking back to the heart, specifically to the left ventricle. Ultimately to the left, and from the left ventricle heart has to go to the whole body. So venous system is very important, where filling pressure and filling time will define what will be the venous return. Talking about the filling pressure first, which is defining the venous system. Filling pressure basically depends on venomotor tone and blood volume. Let me explain the venomotor tone first. So what is venomotor tone? So if you remember the diagram, when the venomotor tone increases, there will be contraction in the major systemic veins and venules. When there is a contraction in major systemic vein and venules, there will be higher pressure generated in the venous side, and blood rapidly goes from venous system to the right atria, right ventricle, left atria and left ventricle. This is how it increases filling pressure, it increases venous return, it increases preload, it increases stroke volume, cardiac output and systolic blood pressure. Second is blood volume. Same way in venomotor tone, if it is decreases, it dilates the venous system, it decreases the preload, it decreases the blood pressure. Similarly, blood volume. If blood volume increases, whether there will be contraction in the venous system or dilation in the venous system, blood volume increase. Because of that, there will be more blood returning to the heart, and if more blood is returning to the heart, more blood will come out of the heart and it will increase the pressure. Next concept is, apart from filling pressure, is filling time. As I discussed here also, if filling time is increased, blood will come more in the ventricular system, and if blood will come more in the ventricular system, please remember the Frank-Starling's law, it will increase the force of contraction as well. So the volume is also increased, contractility or force of contraction is also increased, it will definitely increase the blood pressure. And that is why it depends on diastolic interval. If diastolic interval is longer, If diastolic interval is longer, means this 0.5 second diastole period is higher from 0.5, maybe it is 0.6 or 0.7 because of the low heart rate or maybe because of any other reason, there will be drastic increase in filling time and there will be drastic increase in venous return. Venous return will increase preload, preload will increase stroke volume will increase cardiac output. Ultimately, it will increase systolic blood pressure. So this is the basic fundamental concept of blood pressure, cardiac output, and how the parameters is affecting the cardiac output. As I said, total peripheral resistance is nothing but afterload, and we already discussed the afterload, which depends on the arterioconstriction and venous constriction system. So if any drug or if any disease is contracting the arterioles and venules, it is increasing the resistance against the blood coming from the arteries, and it increases the total peripheral resistance. So ultimately it increases the diastolic blood pressure. So this is how our blood pressure is dependent on this many parameters. In the next video, we will be discussing about the different types of hypertension, etiology or risk factors of hypertension, and fundamentals of pathophysiology of hypertension.